Happening tomorrow, the Pleasanton Unified School District will become the first in Alameda County to have all grade levels back on campus. KPIX5's Andrea Nakano joins us from Pleasanton, where middle and high schoolers will be back in class in just a matter of hours.
The superintendent of Pleasanton Unified says 55% of the students will be coming back to a campus like this one tomorrow in hybrid mode. But a UCSF infectious disease doctor says a full return to school is long overdue.
Online learning's not for every kid, and yet every kid was forced to do it.
After roughly a year away, students at Amador Valley High School will be back on campus tomorrow.
It's not a panacea to just go back in person. This hybrid thing is something new.
This is Alameda County hit red tier metrics for the last 2 weeks.
Once we started to realize that these cohort sizes of the returning students really was doable within the state guidance, it was really full court press. We need to do this because so many kids were struggling.
UCSF infectious disease doctor Monica Gandhi recently addressed the struggles and the science behind a safe return to school in an op-ed in USA Today.
But there is not room for fear anymore to dictate us going back to things like places like schools.
Dr. Gandhi cites data that shows children are at low risk of severe COVID symptoms and viral spread is minimal in schools. She also says there is no science to support mandating 6 feet of social distancing and would like the CDC to adopt the World Health Organization's recommendation of 1 meter, which is roughly 3 feet. That could help public school districts accommodate a full-time return to school now as the country waits to be vaccinated.
All those mitigation procedures can relax once the adults are vaccinated. And we don't need to wait for children vaccination to get back to full in-person learning.
Now, I reached out to the Association of Pleasanton Teachers for their perspective on returning to school, but have not heard back. In Pleasanton, Andrea Nakano, KPIX5.